evening, Mr. Webster. My name is Carol. I'll be your nurse today, and I'm here to perform your abdominal examination. I've already washed my hands. I provided the patient privacy, and also I've got his consent to do the examination as well. Okay, so with this examination, we're going to start with inspecting his abdomen. Then we're going to auscultate his abdomen. Then we're going to percuss, and then we're going to palpate last. Okay, and I'm sorry for this, Professor, but in terms of like trying to figure out how to do the video is kind of difficult, so this was our best option ahead of time, right? Okay, so Damien doesn't want to lift up his shirt, so we're gonna proceed. First, we're gonna look at his abdomen. We want to look for if there's any marks, right? If he has any old scarring. We're also looking to see if he has any pulsations of his abdomen as well, right? We're also, I'm sorry, I've touched it. Pulsation of his abdomen. We're looking for any symmetry as well too. Everything looks fine, right? So then we're gonna proceed to the auscultation part of the examination. So with the abdomen, we're going to divide it into 4 quadrants. We have the right upper quadrant, the left upper quadrant, the left lower quadrant, and then the right lower quadrant as of course, right? So first we're going to start with listening to his right upper quadrant, right? We're going to listen to his bowel sounds, of course. And we're supposed to listen to each quadrant for 5 minutes, right? But for the sake of the video, we won't listen to for 5 minutes, right? But I'll just explain to you what I'm doing. So I'm going to listen to, as we did with the thoracic or cardiac examination, we're going to listen with the bell and the diaphragm of the stethoscope, okay? So I'm going to place the diaphragm and the stethoscope on the right upper quadrant. I'm listening for bowel sounds, of course, the gurgling sounds, right? I listen to the right, and I move to the left with the bell and the diaphragm. I proceed to the left lower. And I proceed to the right lower. All right, so far so good. I hear his bowel sounds and they sound fine. Then I'm going to listen. I'm going to find his belly button, which is right here, and I'm going to go 2 inches above that and listen for his abdominal aorta. I'm listening to see if there's any fluids, which I don't hear any. And I'm going to listen to his iliac aorta as well. The belly point is my landmark. I go below that, about 2 inches. I listen on the right and on the left. Then I go for his femoral arteries. And I'm listening once again if there's any fluids. And so far so good. Damien doesn't have any fluids, right? Thank you. Okay, then we're gonna proceed to percussing his abdomen. So this takes a little bit of work, so to speak, but we're gonna, with the tip of the phalangeal, I'm gonna hit. So with the abdomen, you're supposed to hear tympanic sound like a drum, right? So I'm gonna start. Okay. Okay. Yes, and they do sound like a drum. Now I'm gonna try to percuss the liver, right? So what I'm gonna do is, with the liver, It's supposed to go from with the abdomen to finding the liver. It's supposed to go from tympanic to dull. So I'm gonna start to percuss, find the belly button, right? And we're gonna percuss to where we hear it goes from tympanic to dull. All right. Okay, so it changes right about there, right? So with that concern, I'm gonna look for I think it's the sternum border, and I'm gonna percuss there, right? And the liver should be about 7 centimeters. That would be normal, right? Right. After that, I'm gonna go on to so I percuss that, that's fine. And I'm also gonna percuss the spleen as well too. I might not hear the spleen, right? Spleen, I'm sorry. But the spleen, my landmark should be the anterior axillary line, and find the 10th rib, and it should be within that area because the spleen is under the rib, so to speak. So I won't hear it as well as I heard the liver. Right? Okay, so everything sounds fine where that's concerned. Okay, then I'm gonna move on to the last part of our examination, which will be our palpation portion of the examination. So first we're gonna start with very light palpation, right? With light palpation, we're just gonna need just like a gentle massage, right? We're looking to see, or we're trying to examine if Damien has any pain in the areas of the abdomen, right? If there's any liver enlargement, or if he has any pain to the appendix, any areas of that sort, right? So far, so good. He doesn't express any pain. So then we could move on to deep palpation. With deep palpation, we're gonna do the, I guess, the hook method in a sense, and we're gonna press down. Right. So with the right lower quadrant where the appendix is, right? We're gonna one of the things we can listen for is the McBurney's sign, which is if he has tenderness in this area. So we'll find his belly button, right? And we're gonna find, I think it's called the ASIS, yes. And then we're gonna find 1/3, make an imaginary line, which is 1/3 from there, and then we're gonna press there to see if he has any tenderness, which he doesn't, so he doesn't have any inflammation to his appendix, right? Another thing we can test for as well is rebound tenderness, which is if we press the right lower quadrant, right? If he expresses, if we ask Damon, so tell me if you experience any pain, right? Right? Do you have any pain? If he has any pain when I push down and when I release the pressure, if he has any pain there, that's also a positive sign for rebound tenderness to the abdominal area. So I do that once again, that part, right? And I can also do that for the upper quadrant too, right? And that should be it.